My story began 3 years ago when my family and I went to a hospital in our city. My uncle's wife was giving birth, and we were so excited about the doctor's feedback to tell us about her surgery. And I was particularly very glad that I will have a second cousin. But at that time, I heard a man screaming, blaming himself and blaming the government. And I was so curious to know why he was furious in a place supposed to be calm. And then I decided to go and ask the man. And in front of them I said, "Sir, are you okay? Is there something I can help with?" The man looked back at me and said that he was waiting for the doctor to reassure him about his wife's health situation who just went in labor. And I was like, "Are you crazy? Are you blaming yourself because your wife is giving birth? Aren't you supposed to be happy?" And the man said, No, you didn't understand. Please let me continue." And I said in my head, "Okay, I really hope you give me a good reason for blaming yourself and for saying such bad words." He said that his name is Ali. He is 45 years old. He has 2 children, and he works as a shepherd. He came from a remote village which is far 2 hours than our city. And the fact to come to the hospital cost him 2 weeks' salary. And he was blaming himself for being poor and for not being able to afford his wife's surgery. And he was blaming the government for not having hospitals nearby and for seeing his wife suffering 2 hours before reaching the hospital. He added seeing that a lot of families suffer from the same problem or even worse. And he was like thinking about how he can get money to bring back his baby for the circumcision surgery. And he ended our conversation saying, "Son, I know you can't help, but thank you for caring. I really appreciate." At that moment, I was grateful for having good education and for having good health care. And I promptly went to the man and said, "Sir, I might not have all the answers to your problems, but I promise you, I will do something for you." And after that, I decided to conduct a research in order to understand rural population situation. And thanks to this research, I discovered that there is some major obstacles that make the healthcare facilities inaccessible for everyone. And the first one is there is absence or huge distance between villages and nearest hospitals. So people in rural places find themselves forced to travel from their villages into cities to have access to healthcare services. And the second challenge was there is lack of health-related initiatives. The number of health fairs organized and the number of medical screening organized does not cover all villages' needs. And I also noticed that the government makes huge investments in big cities and builds hospitals, schools, and markets, while neglects people in rural places, which creates, again, a situation of inequity between the two. And the latest statistics from the World Health Organization shows that there is 1 doctor for 1,600 people in Morocco, compared to 1 to 296 in France. This statistics shows the healthcare obstacles in urban areas, let alone if you live in rural places. Health becomes a major preoccupation and a deep source of anxiety. Moreover, population in Morocco dropped from 71% to almost 40% between 1960 and 2014 because in rural places, basic needs are still not made available and people find themselves forced to travel from their villages into big cities to have access to basic needs. And one of the things that really inspired me to take action and to do something for those people in need is the quote of G.F. Kennedy, who said, "Ask not what your country can do for you, but ask what you can do for your country." And yet our government has an important role to play in order to help people in need. But we, as young leaders, should play our role too and should find suitable solutions for our community's problems. As for my case, I founded a campus organization called Student Ambassadors for Peace, which is a former student exchange ideas about how to help their communities. And they get to network and they get to share their skills, aspirations, and hopes for a more healthy and peaceful environment. We organized a health fair And we also believe that healthcare is a human right, and it's a basic need for each individual. For this reason, we organized a health fair in favor of poor villages in Morocco, and we received about 200 beneficiaries. Most of them have diabetes, skin diseases, and malnutrition. And an elementary school with only 4 classrooms is where our event was held. One classroom was used for medical screening. The second, it was used as a pharmacy where medicines were given for free. The third was used to gather illiterate women from the villages in order to raise their awareness about sexually transmitted diseases. And the last room was used for children's circumcision surgery. And interestingly, Ali, the man I met in hospital and who wasn't able to afford his wife's surgery, was between the beneficiaries, and his baby was operated for free, which really affected me. And I really feel that I kept the promise I gave to the man unexpectedly. After the health fair success, we aim to amplify it and make it one of our main projects. Healthy Life is what we call the project. In short term, it consists on organizing more health fairs in villages in Morocco. Within this context, we will be organizing another health fair in behalf of people in villages in Morocco, and we will be receiving 400 beneficiaries from 4 villages in southwest Morocco in June 2014. And in long term, we aim to make a standard process for foreign NGOs to follow. As we documented everything, we are aiming to prepare all the resources, encompassing all guidelines to plan and manage the health fairs. And by this way, we will exponentially increase the number of beneficiaries everywhere. Our vision is to provide international volunteers with the entire management tools so they can duplicate our event in their communities, and so they can address to a large number of people. I strongly believe that we are leaders of tomorrow, but it has to start today, and we have to collaborate with each other in a constructive manner to make our healthcare system better and to provide those in need with the health care services they have long been deprived of. Thank you.